Well, Canada is dealing with unprecedented numbers of people dying from the opioid crisis. And while the numbers are new, the problem is not. In 1993, a BC coroner's office report said drug overdoses had reached, quote, epidemic levels with more than 300 people dying in the province. Well, Garth Mullins was a student at that time, and he has spent his entire adult life taking opioids from illegal drugs like heroin to prescribed medications like methadone. And he has seen firsthand how Canada's drug problem has evolved. He's also the host of Crackdown, a podcast that's run by drug users. And Garth is our guest this morning. Great to meet you. So looking forward to our conversation.
Hey, nice to meet you too.
First of all, how did the idea of Crackdown come to be?
I work with a group of drug user activists, people like me who've been around and, we're trying to look out for each other, trying to change policy. We realized the media wasn't really portraying us as we saw ourselves, wasn't really telling the kind of stories that we wanted to see. So we decided we should try and take it into our own hands. I'd made radio before as a freelancer, and so we all kind of came together and made this project Crackdown.
Let's talk about this idea of misconceptions. This came up in an interview that we did yesterday where a mom who recently lost her son said, there's a big misconception about who are drug users, who are opioid addicts. 80% of them are people that we might meet in any community circumstance.
Oh, sure. People like me who've been a daily heroin user and now a methadone user, we're in your workplaces and in your families, in your communities, in your churches. We're everywhere. So I think it's much more common than people would think.
You describe your work and the work that reporters like yourself are doing as being in a war zone. Talk to me about that.
Sure. I think it was, Nixon or somebody like that called it the war on drugs. And it does feel a lot like a war. Certainly, we're having a lot of casualties, losing a lot of people in BC. We're having record numbers every month. And the sort of the incarceration of people, the presence of police, sometimes very militarized police in neighborhoods and going to enforce the drug laws. It does often feel like a war.
We mentioned that you were around when that first report was released back in the 90s in BC, where they called it an epidemic and there were 300 deaths. We are well over 1,000 every year here in this country. How does that crisis compare to the one that we're living in now?
The one we're living now is so much bigger. I remember in the 90s when we were hitting a projected 400 overdose deaths per year. And in BC, we've been up to 1,500 a year some years recently. And it pales in comparison. And it's hard to believe we're living through a second one. But in some ways, it's completely predictable because the kind of structural changes that we really needed to see the first time around, they never happened. So if we manage to survive this one, we'll see more. And it will affect more and more Canadians. More and more kids like from that mom you were talking about will wind up dead. Not just people who use opioids every day, but people who just go out, for a weekend and party a little bit. And I think every family knows somebody who's vulnerable or affected.
Garth, you went to Portugal last year to look at how decriminalizing personal drug possession is going. It's something that health officials like Dr. Bonnie Henry have said Canada should be doing. I have talked to healthcare workers and politicians and social workers about what the solutions are, but I've never talked to somebody who's actually using or has been a user about what the solutions are. So from your perspective, what will help? What will turn the tide?
Decriminalization is a big part of it. Our lives are ruled by the police. We have to hide our drug use, hide it from family, friends, but especially from law enforcement. That makes things more dangerous for us. I think a big part of the solution is just changing the rules. The pandemic right now, COVID, we don't know what the vaccine is yet. It's a mystery. But for the other epidemic, for the overdose crisis, we do know. There are prescriptions which can address this crisis very quickly. We call it safe supply. It's if people are dying from a contaminated drug supply, then being able to access a pharmaceutical version of what people are taking on the street will save lives very quickly, will end the illegal drug market. It will change the relationship between people and their families, people in their workplaces, because you won't be chased around by police. You won't have all the health threats against you that come with an illicit drug supply. You can, put your life back together. You can have that space.
Garth, really quickly, because we're short on time and I know you understand this, but I have to ask you, for people who say that that is enabling drug users, what's your response?
Well, I know that I'm old enough to remember the how they taught you in school to just say no, and it doesn't really work, right? Like, it's a great idea, and I know every drug user like me has always wanted to quit, has always wanted to find a way out, and a lot of us do, but it can take years and years and years. And right now, the drugs are so toxic, we'll die before we find that kind of place. So, yeah, it's just enabling people to be safe. It's enabling a little humanity. So if that is enabling, then okay, let's bring it on.
Garth Mullins, a real pleasure to meet you. He is the host of a podcast called Crackdown. We'll be right back.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.